Hi everyone, I am Gauri PS, lecturer, Department of Radiology, Global College of Allied Sciences. Today we are going to discuss about the topic CT protocol, that is Computed Tomography Protocol. First, what is CT? CT is an imaging technique in which we use the means of a complex structure which has a multiple detector system which can detect the changes or any abnormalities which are found on the body or a patient. And in CT there are several protocols which has to be followed for specific organs or a specific part of the body. First, a CT protocol is a standardized set of scanning parameters which are used to obtain a diagnostic quality images while minimizing the radiation dose to the patient. Usually, the protocol varies according to the body part being examined and based on the clinical indications which has happened onto the patient. Next is about the components of a CT protocol. So what are the measures which has to be followed during a CT protocol? First is about patient preparation. First, we have to verify about the patient's identity, that is by obtaining an informed consent form for a contrast study. If we are using a contrast for a patient, then it is necessary to maintain a consent form. The consent form will be having the details of the patient's informations and their allergic reactions, their urea creatinine level, and also about the disabnormalities or the allergic reactions based on the contrast or any of the injection which has been prescribed by the patient in earlier studies. So, and we also include the name of the contrast, type of the contrast, and also explain about the patient's condition and also about the study which has been performed to the patient by the radiologist or a radiographer which are present on the station, and they will be informing both the patient and their attendants about all the details. Next, you have to check for pregnancy in case of female patient because of their reproductive age. If they are above the age of 18, it is compulsory noted to note their last menstrual phase, that is about the LMP of the last month where they have last occurred their menses. And you have to assess the renal functions before the IV contrast administration. That is about the kidney's condition. We have to know whether the kidney has an ability to purify the contrast after the examination has to be eliminated from the patient's body. So we have to check whether the renal function is better or not. And it is compulsory to maintain a fasting of 4 to 6 hours before the examination. That is mostly for the case of contrast enhanced studies, as the fasting can improve the imaging quality and also has us to provide a detailed structure of the internal organs. Next is about the patient positioning. Usually in most of the cases, the patient will be positioned in a supine position. Sometimes the arm may be raised above the head in case for chest and abdominal scans, and in case of a skull or a head scan, where the arms of the patient will be placed near or over their abdomen region. Usually immobilization devices will be used, that is to reduce the motion artifacts. In case of a CT scan of brain or a head, we will be using a head pad so that their head will not be, the skull portion will not be in a movement and it will be maintained in a fixed position. And usually in case of an elderly patient, we will be maintaining an abdominal band so that the patient do not move during the complete scanning procedure. If the patient moves, then there will be a motion artifact, then it has to be taken repeated for perfect image and for better imaging qualities. Next is the scanning parameters. Usually the tube voltage will be maintained from the range of 80 to 140 kVp, and the tube current will be maintained of about 50 to 500 milliampere, and the slice thickness will be about 0.5 to 10 mm, and the pitch will be of about 0.5 to 2. and rotation time of the gantry will be of about 0.3 to 1 second, and the matrix size will be 512 into 512. Next is about the contrast administration. Usually in contrast studies, the patient will be given contrast by means of two methods, that is by oral contrast or by means of IV line. In oral contrast, that is mostly we used in case of abdominal cases and pelvic cases. That is, it helps us to visualize the gastrointestinal structures correctly. In case of intravenous contrast, that is we do in case for to view the blood vessels or organs perfectly. Usually the dosage will be about 1 to 2 milliliter per kilogram of the body weight, and the injection rate will be of 2 to 5 ml per second. Next is about the image acquisition phase. That is in non-contrast phase, that is without the administration of a contrast, we will be able to imagine the baseline imaging. That is mostly for the case of trauma, kidney stones, intracranial hemorrhages. In arterial phase, we will be using that is about 20 to 30 seconds. That is for the evaluation of arteries and hypovascular lesions. Next is about venous phase. In venous phase, it is about 60 to 70 seconds. That is, it is the most common phase during an abdominal imaging. Next, we will be following about of delayed phase. That is, it will be delayed by a time of 5 to 15 minutes. That is for the assessment of the urinary tract and the lesion characterization. Next is about the image reconstruction. Usually the images will be reconstructed by axial images, multiplanar reconstruction, coronal, sagittal, 3D volume rendering, and maximum intensity projection, that is MIP. These are the most following characters which we follow during an image reconstruction. Next, what are the common CT protocols? Usually, you will be taking a CT brain. That is mostly of non-contrast study, where the slice thickness will be of about 3 to 5 mm, and it is used for a stroke, trauma or hemorrhages. Next is about the CT chest. In CT chest, the slice thickness will be of about 1 to 5 mm, and it is a breath hold technique where the patient has to hold their breath during a certain time of the scanning, and the contrast may be used for mediastinal evaluation. Next is about CT abdomen and pelvis. It is an oral and IV contrast method where arterial and portal venous phases are taken. In CT angiography, a high flow IV contrast is injected and thin slices, that is about 0.